I'm a nursing assistant, a certified nursing assistant on the Express Admit unit. I've been working as a CNA at Our Lady of the Lake for 5 years. The announcement was made before I got sick that they were going to be putting COVID patients over there. They hadn't started. It started off as a cough on a Tuesday, and everyone at work was looking at me side-eyed for coughing. So I was like, the next day I didn't go to work that Wednesday. I didn't expect to contract COVID. I had the mentality that I've been working in the medical field so long, my immune system is built up, it won't happen to me. After like the 4th day, I was so tired, weak, I couldn't eat or anything. I went back to the hospital. That's when they tested me again for COVID and kept me. I was in the hospital approximately like 71 days, but it was just hard. Not talking, being with my children. My husband could bring me items, but I couldn't physically see him. It was hard. I was able to talk to him on the telephone. I was able to FaceTime him. That's how we communicated. With my children also, I was able to just communicate with the phone. My COVID results came back, and when my COVID results came back, my oxygen level dropped to the 70s. So they transferred me from EDOU to the Express Admit unit. Those were the units that they had as COVID units. The doctor came in and told me that they were going to have to intubate me. I was intubated for 45 days. My kidneys had failed upon me being in the hospital. They was giving me dialysis. I was in a medically induced coma to help me with my breathing. That was the purpose of them intubating me. I have no memory of anything while being intubated. I just had bad dreams. That's all. I remember those dreams, but I really don't want to share them. I remember those dreams, but I don't remember anything else. Like no one talking to me, the doctors at my bedside. I don't recall none of that. People would say that they would come visit me. I was so swole. They didn't know who I was because I had so much fluid on me until I got dialysis. Everyone thought I wasn't going to make it. They were saying rumors that I was going to die. And for me to hear that, it touched me. And it also saddened me because I didn't know I was that bad off, but it just let me know that God was with me throughout all this. After being extubated, I was in PCU and I had a trach. Having the trach was horrible. It was uncomfortable. I wasn't used to it. The mucus, it was just a lot to adjust to. When my children were called, I was talking over not the trach, I was talking over the ventilator. And so that's when they was like, in a couple of days, they'll take the ventilator out. I got the trach removed maybe like 20 days before I was discharged. But after they came in, they worked with me to try to get me to build up my strength before moving me to the rehab unit. Oh, I love rehab. The manager over there is Chad, and the doctors, Dr. Setliff, on rehab, I enjoyed being over there. They took good care of me, motivated me, encouraged me to do better, to going home. It made me look forward to discharge, being on rehab, making me become more independent like I was before. I was afraid of taking pain medication because I see so many people get addicted to pain medicine. It scares me to take pain medicine. I was motivated and I kept my spirit up by thinking about my family, my children. I have a praying mother. She has prayer warriors. They prayed. Everyone was praying for me, my strength and my health. And I just didn't want to let anyone down. That's what keeps me motivated, thinking about my family, because I don't want no one else to raise my children. I'm overly independent. So having to depend on someone to do things for me kind of aggravate me and agitate me because I'm not used to moving on other people's time. I'm used to doing what I want to do. What motivated me so much was Dr. Setliff. Like he'll come in my room every day like to check on my well-being. And he'll be like, okay, I want you to walk 50 feet today. So to reach the goal, I'll walk 100 feet. Just to tell him, oh yeah, Dr. Setliff, when he come the next day, I walked 100 feet. It motivated me every day. Okay, Tasha, I want to see you walk 125 feet. He just motivated me and kept me influenced also to do better. I wanted to prove him wrong. A cold Rocky is when they play the Rocky theme song upon discharge for COVID patients that's discharged from the hospital. The Cold Rocky was a different experience. I didn't expect that many people to be in the HVI towers upon discharge. It was like the vice president of the hospital. Everyone was there cheering me on, giving me words of comfort. Heather Runnels, Irene Schultz, everyone was there. Everybody's telling me don't rush back to work, but I miss everybody. It's like they inbox me and tell me, like on Facebook, they miss me. The unit not the same with my personality. I miss them. It's so much with COVID that people don't understand. They take it for granted, like it won't happen to me, it won't happen to me the way I felt, but anybody can contract it.